On behalf of the Patient Safety Authority, I would like to welcome you to this webinar titled Long-Term Care Emergency Preparedness Educational Series, Analyzing Risks. My name is Joanne Atkins, and I will be your moderator for this program. Now, I'd like to introduce our speaker for the webinar. Amanda Bennett is an infection preventionist for the Patient Safety Authority. In this role, she serves as a resource for Pennsylvania facilities through education and the development and monitoring of infection prevention and reduction initiatives. Ms. Bennett has an extensive background in infection prevention, laboratory testing, analysis and interpretation of diagnostic results, education, and regulatory standards. Amanda, I will now turn the program over to you.
Thank you, Joanne. In order to properly prepare for an emergency, it's crucial to first understand all possible risks and your facility's ability to effectively respond. As we all know, healthcare does not stop when faced with an emergency, and as we've all learned, especially over the last 2 years, in many situations, healthcare becomes even more vital. It's imperative that your facility has a plan in place when these situations arise. An all-hazard risk assessment is your jumping-off point to determine where your facility stands. Which aspects of a response are you already prepared for? What do you still need to work on? And are there situations that you haven't yet thought about? The objectives for today's presentation is to discuss an all-hazards risk assessment, review the planning and assessment process, describe uses and limitations of an all-hazard risk assessment, and list emergency management topics that will require infection prevention input. This is a quote I heard recently from author Seth Godin that felt like it fit well with this topic. If your organization requires success before commitment, it will never have either. I distinctly remember sitting in a meeting in late 2019, going over our facility's risk assessment. And to be honest, it all seemed to be a bit much. I knew the plans were important, but it didn't seem likely that we'd really need to use them. And then a few months later, COVID hit, and those plans were so important. Going back to the quote, there must be a commitment to preparedness and supply sources to be successful when an emergency arises. The COVID pandemic put a spotlight on the importance of preparedness and emergency response. While this process isn't always immediately gratifying, if you put in the work up front, you will move through the disaster more effectively and efficiently. So what exactly is an all-hazards risk assessment? It's a process to identify threats or hazards your facility may face, collecting information on these risks, and then assigning values to determine what your priorities need to be. With this information, you can then move forward to develop and compare courses of action, which will allow you to make informed decisions about the most effective ways you can prepare your facility. Let's first talk about the process of performing a risk assessment. I'm sure many, if not most of you, have experience with an infection control specific risk assessment. But what we're talking about today is a more broad facility-wide risk assessment. Some of the identified risks won't involve infection prevention at all, but going through it, you'll see that many will require an infection preventionist input once you really get into the process. FEMA states there are 4 basic components of a risk assessment, which are to first, identify your hazards, second, profile your hazardous events, then do an inventory of your facility assets, and last, there's an estimation of potential human and economic losses based on the exposure and vulnerability of people, buildings, and infrastructure. Your risk assessment is a living document that needs to be continually updated and reviewed. This is an ongoing process. The steps identified above help you to identify the characteristics and possible consequences of hazards. It's important to take into consideration hazards that might be specific to your geographic region. For example, which industries are in your area and how can these impact or create hazards? Is your area prone to flooding or winter storms? Are there nearby mass transportation stations? Accidents can happen and can lead to a surge in patients. Another thing to take into consideration is your specific resident population and their needs. Are your residents mobile? And if not, what resources would you need to relocate them? What resources do you need to keep services running, and how long will these resources last you? Another thing to consider is the age of the facility itself. If all your staff need to be alerted to an emergency, what is your plan to do that? Do the intercoms work in all areas of the building, and have you tested them? Where are your firewalls located, and are all backup systems routinely checked? This process helps your team understand the risks and fully evaluate your needs. You'll be surprised what comes up and scenarios that you may have never considered before once the process begins. There are some key planning principles that you'll want to keep in mind when going through this process. First is that the causes of emergencies can vary, but many of the effects do not. This really allows you to avoid having unique plans for every single type of hazard or threat. During the planning process, it's possible to address common operational functions and what is needed to keep these running. For example, a train accident or a nearby building fire can both cause a surge of patients, but in both situations, regardless of the cause, you'll need to plan for increased staffing and patient housing. In much the same way, you're able to identify common tasks and those responsible for accomplishing the task. For example, although the speed of onset or size of the affected area can vary, in all scenarios, you'd be able to identify a specific person or department that's responsible for things such as securing the facility, contacting staff for extra coverage, and reaching out to vendors if there's an increased need for supplies. You also need to have scaling planning solutions, which means that your assessment and your plan should be flexible enough to address both a traditional or a catastrophic incident. Planners can test whether critical plan elements are sufficiently flexible by exercising them against scenarios of varying type and magnitude. For example, what happens if you have a power outage that lasts for 5 hours? And then how does that same situation look if the power outage were to last 3 days? And then finally, take advantage of others' experience and tools. We don't need to reinvent the wheel. Rely on the experience of your staff. If someone has done a risk assessment before, use their experience. And then at the end of this presentation, I'll provide risk assessment templates, which can be used and made specific to your facility. So let's get into some specifics. From CMS's 4 core elements of emergency preparedness, which my coworker Joanne reviewed in the first presentation of this series, today we're going to focus on the first of those core elements, which is the risk assessment and emergency planning. This slide covers a broad overview of what should be covered in a risk assessment. It should include, but not be limited to, hazards that are likely in your geographic area, care-related emergencies, equipment and power failures, interruption in communications, including cyber attacks, loss of all or a portion of your facility, loss of all or a portion of your supplies, and then the plan is to be reviewed and updated at least annually. It's important to remember that there are different types of hazards that need to be considered. They include natural hazards, such as disease outbreaks, floods, hurricanes, tornadoes, and winter storms. We also have technological hazards, such as power failures, radiological release, and train derailments. And then finally, there's human-caused hazards, such as civil disturbances, cyber events, and school violence. This is not an all-inclusive list. It's just some examples of hazards that could be relevant for Pennsylvania healthcare facilities. So getting down to some of the nitty-gritty of performing the risk assessment, what you're looking for is an end result of a single indicator of risk, which will take into account the likely frequency of a hazard and the likelihood or the severity of the potential of its consequences. You'll be looking at hazards with qualitative rankings, such as high, medium, or low, and then also with quantitative rankings, such as a scale of 1 to 3 or 1 to 5. This allows your team to compare and prioritize risks to determine which hazards merit special attention in planning. And you'll see this in the example that I present on the next slide. This shows a simple risk assessment. I used a quick calculation of risk just to show the use of analysis for this example. The tools that we provide at the end of this presentation do these calculations for you. On the vertical axis, you have possible risks, and across the horizontal axis, you have the different categories we use to think about severity and consequences. First, you see probability, which is the likelihood that this risk will occur. It's based on known risk and historical data. We then have human impact, which considers the possibility of death or injury, taking into account all persons potentially involved, including staff, residents, and visitors. Property impact is looking at physical losses and damages, including the cost to replace or repair, the cost to set up temporary replacement, the time to recover, and then the cost to repair or replace based on past incidents. The business impact, or the interruption of services. What happens if your staff can't get to work? If there's an interruption in critical supplies, what was the financial impact of that, and what revenue was lost during past incidents? Preparedness or pre-planning includes the status of current plans, the frequency of drills that you've done, training and alternate sources for critical supplies and services. This is essentially how prepared is your facility if this hazard were to happen right now. Your internal response refers to inside your facility. What are your response capabilities in terms of time, effectiveness, and resources? What types and volumes of supplies do you currently have on hand, and what staff is available, and what backup systems are already in place? External response considers the surrounding community and any mutual aid staff and supplies. This can include agreements with community agencies, coordination with local and state agencies, local emergency response availability, and historical evaluation of response success. Please do not forget to consider any historical data. Those are facts that already happened that you can look back and gather information from. They're not assumptions. Again, we're not recreating the wheel. Any information from past events needs to be included. From these results, a numerical risk is then calculated, and your facility should focus on the top 3 to 5 risks for mitigation, preparedness, response, and recovery. From this example, of the 4 potential hazards you see, you would want to focus mainly on a hurricane or a patient surge response. Look at the weak points in those response plans and what you can do to better prepare your facility. It's important to recognize that there are some problems with hazard lists. First, there's exclusion or omission. There's always a potential for new and unexpected risks, which is why it's important to have an all hazards, all threats plan and capability in place. This is also why it's key that this remains a living document, which needs to be revisited and updated as needed or at least annually. Second, when you're performing an all hazards risk assessment, you're essentially creating a grouping of hazards, which can affect subsequent analysis. Lists can give the impression that hazards are independent of each other, but they're oftentimes related. For example, a winter storm can cause a power outage, or an earthquake can cause a dam failure. Repercussions from both of the events would need to be handled simultaneously. Lists may also group different causes, which require different responses. For example, when we talk about a flood, this could include causes such as a dam failure, a cloud burst, or heavy rain upstream. But on the other hand, a list can group a whole range of consequences under this category of a single hazard. Terrorism could include the release of a biological threat or the use of explosives. These 2 consequences would need different responses. The planning team needs to keep in mind all possibilities and outcomes when performing a risk assessment. As we reviewed earlier, not all risks will need infection prevention input, but these are common topics that the infection preventionist does need to be involved in. They include infection control coverage, facility hazard assessment, disaster drills, health alert messages, negative pressure surge capacity, specimen collection, patient management, food safety, water management, sanitation control, pet management, environmental decontamination, crisis standards of care, prioritization of anti-infective therapies, screening triage protocols, occupational health procedures, and outbreak investigation. The following slides will provide you with tools that you can do to do your own risk assessment. They include examples of all hazards risk assessments, FEMA's developing and maintaining emergency operations plans, and the PSA IP contact information. This first example is a risk assessment template from Kaiser Permanente with a link that you can use to access and download this for yourself. An additional risk assessment template from Wisconsin's Department of Health Services is listed here. And then we have developing and maintaining emergency operations plans, which is a comprehensive guide from FEMA, and it provides guidance on the fundamentals of planning and developing emergency operations plans. This is a longer document, but it is well organized, and I recommend you use it. Much of what I covered today is in this guide. And of course, you always have the 3 IPs at the Patient Safety Authority, Joanne, Christine, and myself, to use as a resource. This slide includes our contact information. So remember, this is about managing your risk. You cannot prepare for every possible scenario, but you can be well prepared. And then Joanne, I will now turn the program over to you.
Thank you, Amanda. On the line with us today are 2 experts in emergency preparedness, Jason Brown, who is the Director of Healthcare Emergency Management at Public Health Management Corporation, and Pamela Drake, who is the Deputy Director of Healthcare Emergency Management at Public Health Management Corporation. And they were kind enough to join us for the previous webinars to provide their expertise. Jason or Pam, do you have anything to add to the presentation before we open it up for question and answer time?
This whole program is identifying what are the hazards that you could face, and identifying which ones are your higher priority items. Taking into consideration, we want to be able to plan for those high impact, high life scenarios that may impact your organization. The hazard vulnerability analysis gives you the ability to determine your risks of your level of preparedness and your level of planning to respond to those events.
Thank you, Jason. Pam, do you have anything to add?
Sure. Just as I'm sure may come up in questions, and to an extent you all went over in the presentation, there are numerous resources out there that are templates for these events. Kaiser Permanente being mentioned is one of the most common ones out there in the world of healthcare. One thing I would add to that, though, is a little bit of, make your hazard vulnerability analysis or your risk assessment work for you. So if you do find a template and you use it, don't feel so married to it that you can't make adjustments, right? If you find something is not on that template that you think heavily affects your organization, consider adding that in there. And vice versa, if you're in Pennsylvania and you're looking at your risk of volcano eruption, that's something that you can pretty much feel free to generally delete going forward, and making that template work for you. Your healthcare coalition folks, we can always provide more resources on how to get in touch with them, but they're a great resource as well in helping to access some of those templates, as well as some of what's going on in terms of risk assessments at your county level.
Thank you, Pam. That concludes the slide presentation portion of our program. We are now going to begin our question and answer period. We do have one question in the box. What are common community groups or organizations that we should coordinate with when creating our risk assessment for our facility?
I think it's anybody that you're dependent upon being a partner, whether that's your fire department, your police department, your county EMA. All of those are good resources to reach out to, specifically when those folks are engaged in any of the responses to your organization for the hazards that are present. So if they have a role in the response or mitigation to an event, they would be an anticipated partner for participation in that, or at least providing information on the level of risk in the county or across the state. There's various resources from the Pennsylvania Emergency Management Agency, your county emergency management agency, and quite possibly your local municipal emergency management coordinator of what hazards and risks affect that particular geographical community.
To think about another thing that has come up in risk assessments that I have done previously that I wouldn't have necessarily thought about as an infection preventionist are the companies that you use to keep your day-to-day operations running, such as your transportation. If you have residents and they need to go, either to the hospital or to a rehab, you don't know if those organizations have commitments to other facilities in your area. And so you want to make sure that you're talking with them about their availability to you. And then also your suppliers for food and water that are going to be important to make sure that they can maintain your supplies and that they have plans in place.
Okay, that ties right into another question that has come in. When talking about resources and supplies, is there a good time frame to plan for? How long of a period of supplies should we plan to keep on hand for the facility?
So I think that the question or the answer is kind of loaded. It depends on what the supplies are that we are looking to stock. So if we're looking at all of the equipment and supplies that you need to keep your organization up and running, what's the likelihood of that event lasting a period of time? I think that from a national norm, the 96-hour rule comes into play of ensuring you as a facility can function on your own for 96 hours would be a good goal to shoot for.
Thanks, Jason. We have another question that came in. Why is it the infection preventionist responsibility to assess volcano or hazard risk? Seems like it is an administrative task.
And what I would say from my roles in these assessments as an infection preventionist, you are not the sole person doing your risk assessment for your facility. You should be part of a group of people, including administration, security, all relevant. I mean, pharmacy, nursing administration. This is something you're all working towards as a group. And so not all things are going to include infection prevention, but in those responses, there will be things that infection preventionists should have a say in and be able to voice their opinions.
Thank you, Amanda. We have another question. My corporate organization has one risk assessment that is used for all the facilities. Is this enough, or do I need to be doing something more?
My answer to that would be, I think it's possible that it could be done, assuming that you all share the same hazards. You're geographically located in similar areas. You're in similar communities. If that's the case, yes. However, I doubt that that's truly the case, that each facility has the same set of hazards and the same set of impacts from a different scenario. When you include things like the pipeline that runs through that particular neighborhood, the location to the interstate, all of those things have different hazards and different implications on the facility's geographical location. So they need to be taken into consideration for each individual facility's HVA.
Sorry, I would add to that too, to not only consider your geographic location, but your actual resident population. Not all facilities within the corporation may have the same population. If you have dialysis patients or psychiatric patients, they may need special considerations that might not be included in an overall assessment. So that's something to keep in mind as well.
Thank you, Amanda. We have another question. Based on your experience, what are the typical barriers to implementation of risk mitigation strategies?
It's normally the indicator of, you do your hazard vulnerability analysis, you identify potential gaps in that, and do I have the ability to respond to that event, whether it's the time commitment in writing the plan, if I need to purchase additional equipment, do building modifications, whatever the case may be. And again, that's not necessarily a bad thing from being a barrier. Yes, it's a barrier, but we've identified that as a problem. So even if we don't have the resources to fix the problem, we've at least identified that gap and can prepare of how we're going to manage a response, even if we don't fix the gap at this particular problem. But by and far, usually the monetary issue is probably the largest barrier that we see from facility standpoint.
Something I have seen from facilities that I have worked in, money, obviously, I agree, is always a big deal, but especially with where healthcare is now, where everyone is stretched a little bit thin, this is not something that you're working on that's going to solve an immediate problem. You're planning for the future. And sometimes it's hard to just physically make time to do that. And people need to recognize how important it is to put aside the time and update it. Once you have the plan in place, you're really looking back and just, does anything new come up? Has anything changed within my facility that this plan isn't going to work anymore? But I think that's an issue as well, especially right now, is just making sure people really take the time to do the work.
The webinar will soon be ending, but we have time for one or two more questions if anyone else would like to type a question into the Q&A box. That appears to be the last of the questions. I want to thank everyone for joining us today. If you experienced any issues assessing the evaluation or the certificate of continuing education, please feel free to direct any inquiries to Shelley Mixel at shmixell@pa.gov. This concludes our webinar.